The latest now on the COVID crisis and the race to vaccinate. Close to 74 million Americans have now received at least one dose. That's over 28% of the adult population. But there are signs of cases on the rise in some 15 states. Officials scrambling to convince all Americans to get the shot when they can. Whit Johnson is at a mass vaccination site here in New York. Good morning, Whit.
George, good morning to you. This mass vaccination site here at Citi Field is operating 24/7 and will continue that way during the Mets baseball season. You can see the tables in the station set up behind me. The vaccinations happening as we speak. They're averaging about 2,000 shots per day and hoping to expand, but health officials are increasingly worried that vaccine hesitancy could slow progress.
This morning, the nation's top infectious disease experts pleading with Americans. If you're able to get the vaccine, get it now.
We need to have places where people can get vaccinated, and we need to have people who want to roll up their sleeves to get vaccinated. So that is a work that we have ahead.
Nevada, the latest state to allow everybody 16 and older to get the shot. Mississippi doing the same, hoping to raise its vaccination rates, currently among the lowest in the country. While the national case average is falling, 15 states are seeing at least a 10% increase in the last week, raising concerns about reopening too soon.
We are still in the middle of a serious outbreak. My concern is that we prematurely pull back and don't give the vaccines time to continue to protect the country.
And yet the challenge remains of convincing people to get the shot. A recent poll finding nearly half of Republican men would choose not to get vaccinated. Former President Trump now encouraging his supporters to get vaccinated.
It's a great vaccine, it's a safe vaccine, and it's something that works.
And in Congress, only 75% of House members are currently vaccinated, according to Axios. The concern extends far beyond the Capitol. In the Cherokee Nation in Oklahoma, there are plenty of shots, but not enough willing people.
As we've opened up the vaccines to more people, it seems that the uptake is less, or the participation rate is less, and it's a concern.
Now back here in Queens, this site has already administered more than 22,000 first doses, an effort to reach one of the hardest hit communities in the country. George?
Okay, Whit, thanks very much. We are now joined by one of the world's leading experts in science, medicine, and religion, the director of the National Institutes of Health, Dr. Francis Collins. Dr. Collins, thanks for joining us this morning. We just heard Whit talk about so many Americans still reluctant to get this vaccine. What's the greatest hurdle? How do you convince them?
I think people have been confused by a lot of information that you can find on social media that spread various rumors about the vaccines. I would just really urge everyone to step away from those sources and look at the actual evidence that these are remarkably safe and effective and capable of getting us through this terrible pandemic. And unless we really all roll up our sleeves when we get the chance to do so, this could go on a very long time. So getting vaccinated is not just about yourself. It's about your family, your community. It's about our nation getting past this. This is a love your neighbor moment, and I wish everybody would see it that way.
Well, we're seeing a lot of reluctance, especially among Republican men, as Whit just reported, among conservatives. I want to ask you a question I asked President Biden the other day. How do you get the politics out of this?
Well, wouldn't that be a good thing, George? Unfortunately, politics seems to have gotten into almost everything these days. It is rather stunning, isn't it, that your political party would make a difference in your decision about whether or not to protect yourself against a life-threatening disease. And yet somehow in our country, that's where we've gotten to. Please, everybody, let's step back from that. Look at the evidence. It's all out there. It's very public. And regardless of what your political leanings are, make a decision that's based on the facts, which I believe, if people look at it, will cause you to say, yes, I want this as soon as I can get it, because this is our best hope for getting past a terrible pandemic that has taken more than 535,000 lives in our country alone. And it's not over. This is still going on.
You went to the National Cathedral with Dr. Fauci this week. Clergy from some 25 different denominations got vaccinated. Who are the best messengers here? You say, look at the facts, look at the evidence, look at the science, but who are the best people to deliver that message?
People who are able to have the trust of their communities are the ones we most, I think, need to have help us now, which is why we organized that effort at the National Cathedral. I do think church leaders are in a very strong position to be able to put this information in front of their flocks and ask them to make a wise decision. Maybe somebody like me, you know, an old white guy working for the government, doesn't quite have the same credibility with people out in the community as their pastor, their doctor, their community leaders. We need all of those folks to come forward, and they are doing so in significant numbers to try to spread the word about what the real information is, that this is safe, this is effective, this is something you want for yourself and your family.
You are a geneticist, you're a physician, you're a former director of the Human Genome Project. How concerned are you by these variants that are developing right now? We're seeing them here in New York City. We're seeing cases on the rise in many states.
I'm quite concerned. The one in New York is risen very quickly to be the dominant strain, and it is one that has a variant in it that we're concerned about in terms of reducing its likelihood of responding to some of the treatments, the monoclonal antibodies. Likewise, California has a variant that's rising very quickly that is also of concern. And then this variant that was originally noted in the UK called B117, which now in many parts of the country has become the dominant strain and is more infectious and potentially more serious. This is the moment, therefore, for us to really push the vaccines forward as fast as we can and also encourage everybody to continue, wear your masks when you're outside, avoid those indoor gatherings. We're on a marathon here, and you don't want to give up in the last 2 miles because then you don't win the race. And we can make this happen. And I know everybody's fatigued and tired of those messages, but it is so critical right now. We are close to feeling the end of this coming towards us, but we all have to do it together.
Dr. Collins, thanks for your time and your information this morning.
Well, hey there, GMA fans. Robin Roberts here. Thanks for checking out our YouTube channel. Lots of great stuff here. So go on, click the subscribe button right over here to get more of awesome videos and content from GMA every day, anytime. We thank you for watching, and we'll see you in the morning on GMA.